Mr. Johnson. I'm Tori and I'm here to do your sterile suction. So I've already got my sterile gloves placed on and I have my sterile saline in the catheter here. We already did our hyperoxygenation, our vitals, and our assessment, so we're ready to suction. So with my clean hand, I'm going to attach my catheter to the suction. My sterile hand, I'm going to go ahead and put that catheter into the sterile solution and occlude the thumb port with my clean hand to make sure that my suction is in fact working. Now, suction for an adult should be negative 120 to negative 150. And then I'm going to put a little bit of the Solugel into that sterile hand so that I can get some lubricant on my catheter. And then I'm just going to wrap this around my hand here. Now I'm going to go ahead and insert the catheter into the nasal airway until I can see condensation inside of the catheter, which tells me we're in the trachea, at which point we'll begin to remove the catheter while we suction. Alright, and we're in the trachea, so we'll begin to suction out. Okay, and that should be less than 15 seconds. I'm going to go ahead and dispose of that disposable nasal catheter, and with my non-sterile hand I'm going to reoxygenate my patient using the non-rebreather bag, which that would be if this was a real one, and I'm going to do that for at least a minute. I'm going to be checking their pulse, their respiratory rate and pattern, their SpO2. I'm going to do my assessment here and make sure my patient's doing okay after the suction. I'm going to help my patient get comfortable and make sure that they don't have any questions for me. I'm going to leave the nasal airway in because we're going to be suctioning multiple times, and the less amount of times that we have to insert the nasal airway, the less trauma we inflict on the nasal passage. So we're going to go ahead and leave that nasal airway in, and we'll be back to suction again later.